if you are able to hear me, not hear me, just let me know. Yes.
Okay, so can we start recording?
Yes, yes. You have
Aparna,
already,
can
right?
you also record? Can you also record this? Just a minute.
Yes.
Sabrine, can you just... so hi, mom. I'm Shreya here.
Hi, Shri.
I'm Hi, mom. So I'm currently working, doing my internship at the Ray Foundation. And today with us, we have Aparna, we have Savreen and Tarini, who are also doing their interns at the Ray Foundation. So guys, today we have Miss Raksha Rajesh with us. She is a small intro about her. She's a clinical psychologist. She finished her MSc, MPhil, and RIC registered, and she has an extent
RCI.
RCI, sorry.
That's
Okay.
okay.
Has extensive experience collaborating with professionals on multidisciplinary teams in hospital settings, specializing in assisting adults in navigating complex emotional issues, including depression and anxiety. She also used an integrative, trauma informed, and humanistic therapy approach to help people understand their mind and body, find meaning in their life, and develop effective skills, manage their emotions. Our ultimate goal is to ensure functional recovery of clients and to empower individuals to lead fulfilling lives by confidently navigating to the past, present, and future, accepting acceptance and meaning. So that's about Raksha Rajesh. So, ma'am,
Thank you so much.
we're so honored and glad that you are on board with us today. And about the Ray Foundation, the Ray Foundation is a community-based organization work on rehabilitations and empowerment. And the Ray Foundation is humbled with 50 awards under various categories for its relentless and seamless humanitarian service and outreach. They help create opportunities in the community that can enable individuals and group to help themselves. And the Ray Foundation not only, it also enables and access the key for disabled and non-disabled people, making services accessible in other major areas that they try and work towards it. So that's about the Ray Foundation, and the head of the Ray Foundation is KVJ. If I'm spelling it wrong, Sumitra Prasad is the head of the Ray Foundation, and she is to tell about her. She is really sweet, and we're so glad to be our interns working at the Ray Foundation. Okay.
I have thank you so much for thinking of me for this. I've known um Sumitra, your Sumitra ma'am, very personally, since many, many years. And for for the lack of better word, I think she's extremely inspirational for the kind of work that she does. And yeah, I'm very glad to have known her, and I've been wanting to collaborate with her since years now, and I'm glad this is one small collaboration in some respect, so that's good.
Okay, ma'am. Okay, so today our topic for today is about period cramps. So before going into what about it, I'm just going to give you a small uh, case history about the person that I've interviewed about period cramps. So the person I've interviewed about period cramps, the child stated that she has a regular. First thing is she stated that she has a regular flow of periods every month, but then she stated that she gets terrible period cramps every month, and that keeps getting worse for her every month. And it usually occurs for her on the first day and the second day. And the flow for her on second day, she stated that it's so high for her that she gets easily irritated and angry very much. And she also stated that it's kind of affecting her surroundings, and she does not have control over her mood swings and all that. So the first question for today is: period cramps um, are resulting in heavy mood swings. Why does that occur, ma'am?
So like, so there are different phases of menstrual cycle, right? Like the phases of menstrual cycle are throughout the month for us. Since we all are women, I'm going to talk for us. For us. So specifically, if you want to address about the client, I'll just take it at the second half. But overall, if you see, the mood swings start occurring for people who have something known as PMS, premenstrual syndrome. So let me just talk about a little about that. When we talk about PMS, it's called not a symptom, but a syndrome because those are collection of symptoms. So there are different things which happens in your body. The body starts preparing itself for menses. Something which specifically happens 2 weeks approximately before your period cycle is when the hormone called estrogen drops, when it starts preparing for menses. Now, what happens is when your estrogen drops, there is an association with serotonin, that's a neurotransmitter also dropping. So if estrogen drops and serotonin drops, serotonin is also something which overall maintains your rational thinking, mood. It's the feel good hormone, right? And a neurotransmitter. So not only during periods, but the mood swings, irritability, a less of um, having proper judgment, the ability to take different perspectives into picture, giving others the benefit of doubt, giving yourself the benefit of doubt, not regretting every action that you take, or being impulsive or being short-tempered already start happening before your period cycle begins. Now, something which is very important to understand is not every period cycle is the same, neither is every PMS the same, and neither is every PMS for every people the same. Okay, so for example, when you're talking about pain, like body pain and pain during periods, the clinical term for it is known as dysmenorrhea. So when we are talking about dysmenorrhea, not every person has that. But can dysmenorrhea also cause changes in mood? Yes. Imagine a person's body is basically flushing out their tissues. Yes, it's going to cause irritation. Plus, if you add pain with it, it's pain itself has such huge psychological aspect involved with it. If someone is inflicting pain to you, or if your body themselves is inflicting pain on you, it's going to have some repercussions. So, majorly, if you see during periods, if you're talking about mood changes, yes, the period of it is going to be very tough for women, and people who identify as women who have that. That means I'm talking about transsexuals also. And when they go through with it, the major aspect is mood swings and interpersonal relationships, which get majorly affected. And because mood swings alone, obviously there are different irritability, then there is anger, frustration, sadness. You go through the entire spectrum of mood, but then when you start having, you jump on with people with it, then you might end up saying something that you don't necessarily mean. And that can go around with having frequent fights with your spouse, probably being angry with your children, with your parents. So it has the repercussions are seen more in interpersonal relationship because especially if it's a spouse and if that's a male spouse, they might not clearly understand what you are going through, and sometimes even you don't. And that gets a very tricky space because then the communication pattern becomes very important. Um, coming back to the case that you said, you mentioned that she's 19-year-old. Now, if she's 19-year-old, we are assuming that she goes to college. She stays with her parents, or even if she's staying alone with her, if she's staying in a hostel and she's moved out of her house, that is a completely different scenario and an environment because when we are talking about individual and individual's mental health, mood swings, regulation, dysregulation, decision making, it doesn't come in isolation. It comes with your immediate environment. So, what kind of immediate environment are you in? Is it safe? Is it comfortable? Can you talk to the people around you? Can you be in pain comfortably while being uncomfortable? So, all these things together, it can't be seen in isolation as period cramps only, but it comes from period cramps, it comes from hormonal disbalance, it comes from neurotransmitter disbalance, it comes with interpersonal relationships, it comes with also psychosocial context, and also the demand that our work and education puts on us. Now imagine if she has to go and write an exam the next day or that day. That is an added pressure or an added event or an added experience which will completely throw her off because when because the serotonin is still low during those days. That means the judgment, the mood swings, the impulsivity is still high. So that can have an effect. Now, while having said this, not every person's period cramps or PMS will look the same. So it really depends on a lot of other contextual factors that needs to be considered while talking to people who go through this.
Thank you so much, ma'am. That was very beautifully said by you.
Thank you.
Okay, moving on to the next question. Um, Ma'am, so during period, when we are menstruating, we know we have different mood swings and we have different
Mm.
emotions. And why is it difficult to have control over our emotions during that time? Why can't we have control over emotions during our periods?
Yeah, like I said, it is not that you can't have a control. It's not that you are dysregulated 24/7 when you're on menses, right? Your serotonin does play a role in how you feel. Like I said, it's a feel-good hormone. Now, if you take a girl's example, a girl A, let's call her A. Now, she, on her less serotonin, understands how her body works during her periods and is able to navigate, regulate, communicate, very importantly, of how she feels. So, she's in a much better position to explain that to others as well. Versus someone who is a person B who doesn't have as much knowledge about her own body and the kind of changes her body goes through during periods. And if she ends up dysregulating constantly, that becomes an issue. That's where we talk about why is menstrual education so important. When we're talking about menstrual and sex education, it is not just about what happens in between two people or between just what needs to be the sanitary aspect of care, but it also talks about how your body changes. Like women don't often know what phases are there. There are 4 phases of menstrual cycle. When are you supposed to do the heavy work? When are you not supposed to do the heavy work? When is the emotions going to be completely all over the place? For some people are able to handle it well. So education takes a very big part in that. And also communication. Like some people know about when they're dysregulating, but don't feel comfortable enough to talk to other people about it. Just saying the sentence that I am on my menses. How many of us say that very comfortably? And even to our employers, like even to like the in my office or in my field itself, being clinical psychologists, so many of us have admitted that even saying I am on my menses, I don't think I'm doing well. These two sentences are very hard to come. So if that is where the problem is, mood dysregulation and being completely all over the place and handling that kind of comes secondary. And yes, some people do go through that. And for that, there are different kind of strategies that we can use. Starts with emotion regulation or distress tolerance strategies. We also talk about a lot of somatic work. When we talk about somatic work, like working with your body is soma. So somatic work, we talk about mindfulness meditations. We talk about stretching, using your body, dance movement therapy. All these things really come handy when um, expressing or letting go of that tension in the body and in your mind. So that's how we go around navigating that space for clients.
Thank you so much, ma'am. Yeah, it was another beautifully answered question. Um, and okay. So, ma'am, so does periods affect our mental health in a psychological way? Uh,
Yes,
if if it does, can you explain us, brief us about it?
yes, most definitely. And I think different situational differences with every menses also takes a role. Like when I said about a woman's responsibilities or the kind of demands which are put, if it is that they are preparing, like it starts from the very beginning. A woman starts, a girl starts menstruating when she's almost like 12 to 13. She's in school, secondary school to college, college to higher education to work, work to marriage, marriage to children, to menopause. Like it's almost a journey of around 25, 30 years of right now it's 30 to 35 years of menses. 35 years of bleeding for 4 to 5 days every single month. That's crazy. And the kind of toll that it takes on your body is something that, like all the answers that I even gave previously, the major crux of psychological breakdown during these few days, during the month, is the communication aspect of it, is and also understanding, like if you don't understand what it looks for you, like okay, if I was calm and if I was regulated and if it was not quote unquote those days of the month, would I have reacted in a different way? And if the answer is yes, what are those reactions? Would I be crying? Would I be emotional? Would I be snapping at people, short-temperedness, impulsivity, shouting, like everything together? When, how much emotional awareness do we have on a daily basis for us to understand when we are not emotionally okay? For us to understand, okay, maybe things are still okay on the outside. Maybe I need to check if I'm PMSing. So yes, the psychological toll is not for the days of the period. Women are more prone to emotional disorders also heavily because of the kind of menstrual cycle people have, and especially people who go through PCOS. That's a that's a different game altogether. The amount of hormonal dysregulation that happens during for them is completely different because imagine the serotonin being low, estrogen is low, but then there are you still have irregular periods. It takes a toll on your body and your mind. And like you said, like expressing interpersonal issues are the major concern that people bring up in when they even talk about PMS because they end up snapping, they end up crying, or they don't have a necessary trigger. They are not able to perform at work due to dysmenorrhea. They are not able to give their 100% in exams. Children are not able to sit and study for longer hours before their exams if they're due. if they're having menses during that time. So yes, like it takes a big hit on your self-esteem, it takes a big hit on your self-confidence, your relationships, um, and also your body. I mean, you have to live with this body for the rest of your life. And if it starts giving you as much pain as it does on an every month basis, then the least that people can do to begin with is start understanding how the body reacts. And that's what, when we talk about somatic work or even yoga for that matter, even mindfulness or meditation for that matter, talks about it, that understand your body is not different from your mind. I mean, your brain is basically, your brain has the pituitary gland, which is the master gland, which talks about hormones. But if you completely ignore the kind of effect your brain has on your body, but still talk about menstrual cycle without talking about mental health, it doesn't add up because your brain is basically producing everything. So yes, it's one and the same. I don't see it as different at all. Like when we talk about menses, when we talk about menstrual health, mental health doesn't come as a separate topic. It comes together. Like it's health at the end of the day. So
Thank you, ma'am. So we've been talking about PMS. So when PMSing, the case is found to be that a person gets panic easily and they have sweaty palms, they have heart
Mm,
palpitations and all that.
mm.
How can that be managed?
So sometimes the symptoms that you mentioned are very similar to that of anxiety. So if the person, one is a thorough examination and clinical assessment of whether the person has PMS or something called the premenstrual dysphoric disorder, also known as PMDD, which is also coming in the spectrum of depression disorders, where if a person has that, then the management of it is a little different. But on a general basis, if people have palpitations, if they have sweaty palms, irritability, feeling extremely restless, feeling that their chest is heavy and they're not able to manage their work, we generally talk about grounding exercises. Sometimes we talk about this exercise known as five senses exercise, which is the most commonly used grounding exercise. Um, there is also box breathing exercise, which I use personally, and it has helped tremendously for me in my daily life. Which also is a kind of grounding exercise, but it talks about breath work more as compared to your visual and five senses. There's also a very good concept in one of the therapies also where they talk about um, ice, using ice to help you for your panic attacks. So that cold compression or anything cold, splashing your face with cold water, taking a cold water shower, eating ice or keeping ice in your palms really tightly. So basically, it regulates your nervous system from overregulation to coming down to a moderate level of working. So there are some strategies, but also a long-term care would be required for some people because there would be specific triggers which might have been affecting this. So it's not only during PMS, but it also happens otherwise. So it gets very tricky and it can't be seen in isolation.
Actually, thank you so much. I think you've covered a lot of answers that I actually want to ask. And is there anything else that you want to share with us regarding?
I think the most important part of I like I said, I mentioned about the fact that periods or menses is not only about body or mind. And the day that we stop seeing it as body or mind and just talk about it as menses, I think the battle is won that day, because we it is it is our body. Our body will not exist if we don't have a brain. And people still tend to see it separately, is something which needs to be changed only with dialogues. Something like, what, this has been a dialogue, and this is our contribution to talking about it. And secondly, two things. Secondly, not every person has PMS. Not every person has the kind of period cramps that it does. But that does not mean people who have PMS or period cramps cannot regulate themselves. And if anybody feels that this is what they face on an every month basis, you can go and seek help. There are strategies to help you go through this, and you don't. People have seen changes. They have seen um, changes in their relationship, their reactions when they have menses, when they start learning the skills and the techniques to help them regulate themselves. So you can learn it. It's not something which is not accessible.
So much, ma'am, summarizing everything on this. We are so glad and honored to have you here today.
Thank
And
you. Likewise.
it's a Sunday, and you just spare a little time for us as a whole
No
deal. And
problem.
Sundays are actually off for a lot of people, and we're so happy that you spared a little time for us. We are so glad and happy having you on board with us today and learning a lot about periods, and which are indeed there's a few stuffs we ourselves don't know becoming a teenager, and knowing about period cramps and all the PMS and the side effects of periods as a teenager. I think that's a very important topic for a lot of teenage girls to know about it. And I think we've learned a lot about periods cramp today, and I think it'll be useful for us, and I think we will learn more about period cramps when we're just going a little ahead of time.
Yes.
And yeah, so thank you so much. We're so glad, and I just don't know how to thank you, but we're just so
No
happy to have you.
problem. No problem at all. When you also when you reached out to me, part of me working on a Sunday, which I generally don't. It's also because of the kind of person Sumitra ma'am has been for me. So just a little something. So it's okay. It's fine. I would be glad to do sessions like this. So yes, thank you for thinking of
Yes,
me for this. Yes.
I'm thanking you from behalf of me and from the interns, from the people who are here today, and on behalf of Sumitra ma'am, and from behalf of the Ray Foundation. We are very glad. Thank you so much for having connect with us today.
Thank you.
Just
I would like to know a little bit of everybody. Are you all also from the psych background? How does it work? If you
yeah,
guys
we
could
are
just
from
take turns. Okay.
psychology background. Yeah.
So where are you all studying? Are you all from the same university or
Actually, me, Shreya, Tarini, we are from the same college. Like me and Shreya, we completed second year, Tarini completed first year, and Sabri is done with her. She is doing her
Masters.
MA, masters.
okay?
It's done with her master.
Where have you done your masters from, Saveen?
I'm actually I changed my field
Hmm.
after bachelor's, so I completed my MA in counseling psychology from an open university.
Oh,
So
IGNO?
I'm IGNO, yes.
Okay, okay,
Yeah.
okay. So initially, like bachelor's was in for
It
you?
was in biotech honors.
Oh, wow, okay. How are you feeling about the change?
Pretty good actually, because until very long I could not get, I could not understand that this was something maybe that I was meant to do, because some things when they come naturally to you. You do not give much credit to them because you don't have to put any kind of effort.
That's
Right.
true.
It was only after my bachelor's that I came to know, okay, this is something that I can pursue further, because this was a suggestion from a lot of people. But I had a, taboo. Okay, you are not going to go to an arts college, stuff
Yeah.
like that. But yeah, so I worked that for myself, and here I am. And I'm
Good.
pretty good at it. Like,
Yeah,
I'm pretty glad
good,
that I did.
good. I hope everybody has their good, nice journey in psychology, however you seem fit. Is a lot of work to do. And if anybody tells you that there is not enough work in the field, tell them to not talk to them or just don't talk to them, because there's a lot of work to do. There are a lot of people doing a lot of good work, meaningful work which gives you money also. So don't worry. Like, just I've been doing this with so many people who are aspiring psychologists, and this is something that they keep asking. So, free advice. Okay. Right. Thank you so much. Nice seeing you all. Bye.
Thank you, ma'am. Thank you for agreeing to do this. Thank you.
No problem at all. Bye.
Thank you, ma'am. Bye.
Thank you. Bye.
I'll stop recording.
Hello.